Hello everyone, I am Dr. Shrikant Bathini, a consultant nephrologist at Asian Institute of Nephrology and Urology, Hyderabad, India. I'm part of the social media team of ISN SCCon 2024, the conference to be held in Hyderabad in February 2024. So this video is part of a curtain raiser event, which leads to our future speakers in the conference. I have with me Dr. Shafi Mallik, who is a transplant nephrologist from the UK, renowned researcher and educationalist, and a very good speaker. So he has a vast clinical experience as a transplant nephrologist and researcher. He designs courses on epidemiology and biostatistics in the UK. He's an examiner for PLAB. He's a member of the UK Transplant Study Group, and he's also an associate editor for the Royal College of Physicians. Welcome, Dr. Mallik.
Thank you, Dr. Shrikant. Thanks for the kind introduction.
Dr. Mallik, you've chosen a complicated topic, the donation of kidneys from obese donors. So I believe your main interest is in transplant nephrology. You've done a fellowship and you've been a practicing transplant nephrologist for the past 20 years. So what led you to choose transplantation in nephrology?
Good question. I guess the interest started off because I see patients on both sides of the divide. So I see patients before they go for transplantation when they're on dialysis or they've got end-stage renal disease. And then I see patients immediately post-operatively when they come to clinic. And I can see the difference transplantation makes to them, both to their survival and the quality of life. Suddenly they can eat and drink what they have, what they like. They have better energy levels. They can spend time with their family, travel. So it's those little things and that big dramatic change in their quality of life that one single operation provides. So it's the change that I see in patients that actually motivated me to pursue a career in transplantation.
All right. So with respect to the UK, how frequently do you see an obese donor?
So I was going to say, and as you probably know, we have a obesity epidemic. Since 1975, the obesity rates have actually tripled, adding a huge burden to the health economy, costing billions of extra pounds. And similarly, I'm sure in India you've got a similar problem. Um, I think historically we've been quite cautious with choosing obese donors. We used to only do donors with BMI of 25, but now we've started becoming a little bit more less cautious. So we've started accepting more obese donors. And I guess because of the obesity pandemic and because live donor transplants are preferred over disease donor transplants, mainly because of the better survival with live donor transplants. And if we have a recipient who has a well-matched live donor who's very motivated to make a difference to their loved one's life, then the question then becomes, if they're obese, should we be not considering them, and what's the evidence behind it? And if we should be considering them, what should be the evidence behind it? Or perhaps they should undergo certain surgeries to make them more suitable, or lifestyle changes. So we look at all the evidence behind this and see what the decision making process should be for such obese donors.
I see you have given quite a glimpse of your upcoming talk at ISNSC Con.
It'll be a hard topic, I think. And I was just going to add similarly, I think, as you know, we've got an obesity paradox in recipients, and we've got obese recipients. And very briefly, I can touch on whether, we should be having a BMI cutoff for recipients who have transplantation. Who want to be transplanted, who are otherwise fit and suitable, young. So we look at, how we approach those cases, whether they need certain surgeries and so forth, and whether there should be a BMI cutoff or not. So we'll look at recipients as well very briefly.
Okay. I see you are part of the transplant study group in the UK. So how frequently, for how long would you follow these obese donors with respect to their lipid parameters?
Yes, so one advantage we have in the UK is that because it's a national health service and we've got a good primary care setup, secondary and tertiary care setup, and we've got good registries. So once someone becomes a donor, they actually get free lifelong renal slash healthcare follow-up. So we've got records of every donor in the country. Well, majority of the donors. I think the dropout rate is very small. So every year we actually have to submit a paperwork which is filled by the coordinators, whether the donor has been assessed, whether they've developed any health complications, and we've got to submit it to the registry. So we've got lifelong follow-up data for all the donors in the country, actually, at least a vast majority of them.
So, Dr. Malik, would you speak on the complexities that obese recipients have when faced with kidney transplantation?
Yes, so as we discussed earlier, transplantation should be the gold standard for those who are eligible to undergo the procedure, mainly for its quality of life and survival benefits. And as you know, we've got a obesity paradox in transplant recipients or potential transplant recipients when they're on dialysis. Actually, the obesity is protective and lowers their mortality risk. And therefore, if we've got recipients over BMI of say 40 or 45, should we be not stopping them from undergoing a life-changing surgery? And if they are otherwise fit and well, what we'll do during the talk is go through a systematic review which we've recently published. So we'll look at the time points very briefly. If they should go any additional surgery, should it be done during transplantation, after, or even before, and looking at any complications and so forth, and trying to widen the criteria and trying to get more people transplanted. So we'll very briefly touch on that as well during my talk.
That's going to be wonderful, I think, because as you rightly pointed out, there is an epidemic of obesity in the general population as well as patients who are on dialysis right now, so-called the kidney seekers. So an estimate in the US says that around 60% of kidney transplant seekers are obese. So these people shouldn't be denied of a better quality of life, as you've rightly pointed out. I believe your talk is going to be a wonderful one, and I'd be happy to listen to it in person.
Thank you.
Thank you, everyone, for joining us. This is the Curtain Raiser event for Dr. Malik's talk, and we'd stay tuned on Twitter for further Curtain Raiser events. Thank you, everyone.